Good day, students, and welcome to week 6 of SPED 185 as we continue our discourse on Module 3, looking at low incidence special needs. In today's session, the following are our learning objectives. One, by the end of the session, we want that students would be able to understand that special educators working in inclusive settings often serve students across disability categories or students with a wide array of educational needs, and this has been an objective that spanned module 2 as well as for this module 3. So we've been looking at this one for a few weeks now. We would also like to describe and discuss the prevalence and characteristics of students with very low incidence disabilities. Describe and discuss the prevalence and characteristics of students who are gifted and talented, as well as continue to recommend accommodations and modifications to promote inclusion of students with lower incidence disabilities. In today's session, particularly, we'll be looking at low incidence disabilities as well as students who are gifted and talented. So let's start with very low incidence disabilities. When persons have more than one disability that is low incidence, and last week we would have established that a low incidence disability occurs not so often in the general population, right? The differentiation for today's topic is that these disabilities are very low in their occurrence. So when persons have more than one disability that is low incidence, their classification can sometimes fall into the category of very low incidence disabilities. Having more than one disability presents a unique challenge to individuals and their families, and these types of disabilities are typically severe in nature and require substantial and intensive accommodations, modifications, support, instruction, and of course, special education services. These disabilities include deaf blindness, and last week we would have looked at the definitions for deafness and those persons who may be hard of hearing. So we realized that in this disability, for this disability label now, deaf blindness, it's a combination of a person who is deaf as well as a person who may have a visual impairment. And we also looked at that last week. It also includes multiple severe disabilities as well as traumatic brain injury. Now, each of these disabilities label, they have separate definitions, but what I want you to note is that they all share similarities. Persons with multiple severe disabilities present a varied range of skills and abilities, as well as persons who are both deaf and blind, as well as persons who have been characterized as having TBI. Now, many factors can cause these disabilities. Some of these include heredity, problems during pregnancy, low birth weight, incidents after birth, problems at the time of birth, and a number of other unknown factors. Universal access to health care, as well as a raised public awareness of prevention strategies, can most definitely benefit in prevention. So let's get specific at this time. What is deaf blindness? Well, it's a dual disability involving both vision and hearing problems. As prospective teachers, because these persons have a rightful place in the inclusive setting, it's important to know that persons with deaf blindness have enough residual vision to allow them to read enlarged print, to see sign language, and to move about in the environment, to be able to recognize friends and family. Some have no usable vision or hearing, but most have some functional use of either hearing or vision or both. Now, each individual's disability comes across in a different, unique way, requiring that as educators you make no assumption about the educational programs that would be needed. Whatever is planned must be specific to the student's need. Traumatic brain injury, that refers to head injury, which causes reduced cognitive functioning, limited attention, and impulsivity. Sometimes the need for support for students who have been diagnosed with TBI may be temporary, and in other cases, it may be something ongoing requiring a special education program to be put in place. Those with moderate to severe injuries often experience dramatic changes in their cognitive, language, motor, sensory, and behavioral performance. However, many have similar learning characteristics as their regular or perceived to be normal classmates and those with learning disabilities. Persons with TBI often experience memory deficits, attention problems, language impairments, and reduced academic performance. Multiple severe disabilities, also referred to as developmental disabilities, are those disabilities that are severe that combine intellectual as well as physical problems. Various disabilities are included. Some examples would be speech, physical mobility, learning disabilities, intellectual disability, visual, hearing, brain injury, and perhaps even sensory losses and behavior or social problems. Children ages 3 to 5 are considered to have multiple disabilities when they demonstrate associated cognitive, physical, and or sensory impairments, which result in severe delays in development. So, what can you as a class teacher do for a person or a student who has been diagnosed with any of these very low incidence disabilities? Well, high quality early intervention, and it would start at the preschool level. Those can determine critical outcomes for students. For those who participate in the inclusive setting, and especially as it relates to very low incidence disabilities, many of these students, their RTI placement, their least restrictive placement, that environment may not be the general education classroom. But for those who are able to participate in the inclusive setting, there are 4 types of accommodations that they can receive. The first is in terms of presentation. So that is how the content is delivered. Equipment or materials, so that relates to what resources the students are given to be able to interact with, to explore, and be able to engage in the content. Response, in terms of how that student is expected to demonstrate their learning, as well as scheduling. So that refers to timetabling during the day and so on. These 4 types of accommodations should be made available to students in any of the categories for very low incidence disabilities. Best practice for students is individualized instruction, and in our next session, we'll be looking more at that. We move on now to giftedness and talented. When we refer to someone as being gifted or talented, I'm sure that you would have heard about this category before, and it really means that that person has some sort of exceptional ability. A person who is gifted has outstanding natural abilities. So that person was not coached in any way. So maybe someone might be gifted in math. So you'll find from a very young age that child is able to do problems that require higher order thinking that supersedes the class level or even the age level that the student is at. In such a case, we will refer to that student as being gifted. A student who is talented has the ability to master some sort of skill or some area, but it occurs through systematic development of the abilities. So maybe a student may be able to sing well, and through additional coaching, voice training, practicing, that student develops outstanding ability, and the student is able to do very well. So that's the differentiation between gifted and talented. What is important to note is that many people with disabilities are also gifted and talented. And we would have come across the term comorbid before when we spoke about having more than one disability. But in terms of a person who is gifted and or talented, if they have another disability, we refer to that person as being twice exceptional. So that term, twice exceptional, only relates to a person who is gifted or talented and they have another disability. So it can be gifted and talented as well as physical impairment, or gifted or talented and ADHD. We refer to that person as being twice exceptional. In terms of the classroom environment, persons who are gifted and or talented, they oftentimes are not really catered for in the classroom. And so you will find that these students exhibit behavior challenges, or these students are not motivated to learn, given that what is occurring, the work that is planned for them in the classroom environment doesn't meet their needs, and they get bored, they get frustrated, and they feel as though they do not belong. So educators should pay particular attention to these children, and through a differentiated curriculum. And differentiation can occur through content, process, or product. Content meaning the level of work that is given to the students, so that can be varied. And when we talk about differentiation, I'm speaking about varying what is offered to students in the classroom now. So when we vary content, it refers to what the student has to learn. Process refers to the way the student has to interact or explore the material. And product refers to how the student will be able to interact with that material. So differentiation of content, process, and or product is a good way to meet the needs of students who are gifted and talented in the classroom. In this way, they receive different learning experiences that are above and beyond those to their typical peers through the general education curriculum. Another means of meeting the educational needs of both high achievers as well as gifted students is through enrichment. And in this approach, we add additional topics, we broaden the content that is being presented, or we provide depth to the general education curriculum. This is where I will leave you today. I encourage you to read the lecture notes as well as engage in the activities posted on the Learning Forum and get involved in this week's discussion.